Welcome back to Elite Orthocare. Today we have an expert specialist on our channel, Dr. Abhinandhan himself. He will be giving us a 360 overview on what a slip disc is and more about it.
Thank you for inviting me for this channel. I'm really excited to talk on slip disc. This is something which I see a lot in my clinic. I'm happy to bust some myths and give some real solutions for the problem.
So how do you feel coming on this channel?
Oh, I'm super excited.
That's great.
Thank you very much. Thanks for the invite. Let us talk today more on slip disc and
it's nice if we get to know more about slip disc.
Yeah, definitely. You. Of course, I'll clear all the doubts about slip disc.
I actually wanted to know what a slip disc is. The audience also wants to know. Okay. So is it something that slips out easily?
Slip disc is actually a misnomer. The disc in the spine does not slip out. What actually happens is there is a soft material which is surrounded by a fibrous tissue between the two bones that actually bulges out from the fibrous tissue. That is what causes the nerve pain. That is what we call a slip disc. It is not the disc which pops out actually.
It's basically a slip disc that's been popping out. Can we not push it back?
No, that's a myth.
Since you said that's a myth, I have a list of myths listed out. So can we do a rapid fire to burst all of them out?
Oh yeah, let's do it.
First myth, slip disc means lifelong back pain.
False. Most slip discs heal with treatment.
You need complete bed rest to heal a slip disc.
Pain is acute. I would recommend rest, but you don't need to have complete bed rest. Once the pain comes down, you should start doing a mobility exercise.
Myth 3. Lifting anything heavy will cause a slip disc.
No, it's the bad posture during the lifting which causes the slip disc plus aging. These are two common factors which most of the time causes.
Myth 4. If you have a slip disc, you'll definitely need surgery.
Only in extreme cases. 90% of the slip disc do heal by themselves.
Wow, I'm sure a lot of listeners have just had a breath of relief on listening to what is a myth and what isn't. Who are at most risks when it comes to having a slip disc?
There are a few pointers. One is a sedentary lifestyle, poor posture during sitting, people who often lift heavy weights in a poor posture that can lead to a slip disc, and normally due to aging the disc loses its flexibility, can cause a slip disc, and obesity of course is one of the reasons which can slip disc.
So it's not just weightlifters, even people sitting at desks all day can get it?
In fact, people who have bad posture and sit on longer days usually lack muscle strength. Simple lifting activities can cause slip disc in those individuals.
Okay, I need to fix my posture right away. Can you tell me people that are involved in having the risk of a slip disc? All the symptoms involved in a slip disc?
Yes, symptoms can include, one is back pain, stiffness, muscle spasm, pain radiating along the leg, and weakness.
And when should someone stop ignoring it and see a doctor?
If there is only a back pain, you can take a rest, do some physical therapy such as keeping ice and hot pack. If the pain persists more than a week or associated with tingling, numbness or involvement of bowel and bladder, you should see a doctor immediately.
Loss of bladder control, that sounds serious.
Medical emergency, we call it cauda equina syndrome. If you have loss of bladder control and loss of sensation around the private parts, you need to see the doctor immediately.
Let's talk solutions. The biggest mistake that people do when they have a slip disc.
One thing is ignoring it. Whenever you have a slip disc, take a rest.
Thank you, doctor. I think our listeners really loved bursting each myth, for giving us great solutions. I think we've learned a lot as listeners as well. Thank you for great advice.
Listen to your body, stay active, and don't believe every myth you hear in the society.